name's Teroy and been a nurse for about 10 years. Majority of my career, I've worked in the ICU, and the last couple years before coming back to traveling, I've been working in the cath lab. I wanted to be a doctor when I was a younger kid, and looked into how much school I had to go to and decided that maybe that wasn't the commitment I wanted to make. So started looking into the nursing side of things and saw that there was a lot of flexibility and freedom with the job. I had already known about travel nursing and kind of had that as a future plan, and ended up going for it after I got a couple of years, or a year and a half experience, I think, is when I started traveling. How I've done my traveling is I've gone to a lot of the same places multiple times, which for me is kind of keeps it on a comfort level that I'm okay with. You don't know until you've been, and if you've been and it's okay, I've kept good connections with those places. So I think I've traveled to Reno 2 or 3 times. I've traveled up here in Alaska before moving up here permanently 2 or 3 times, and I've traveled in Rapid City, I think 3 times as well. I guess at my current job, I just like the group of people I work with. We have a pretty tight-knit group, and there's lots of help, and so just working as a team, I guess, just like the team aspect of it. My favorite part about traveling, money's nice, but I think the biggest part of it is having the freedom to check either other places out, or putting in the work, grinding hard for 3 months or 6 months, whatever it happens to be, and being able to not have to ask for permission to take a month off. You can make a little bit of extra money, but then what do you do with it if you're working all the time? So I really enjoy the breaks in between, being able to just put in contracts that I need these 10 days off. For the most part, I've been pretty lucky in my career and getting the days off that I want. So really the freedom in between contracts, I guess, is what's important to me. I think the biggest thing with traveling is being open-minded and understanding that you're there to help, and sometimes that's not the typical role that you maybe were as a staff nurse. So being flexible and going into everything with just an open mind and good attitude. I mean, worst case scenario, you're kind of doing something that's not so great for 10 or 12 hours, whatever it happens to be. And then being able to stick up for yourself too. I've been on assignment where I've had really difficult patients, and I think it's just being able to approach your either charge or management in that situation and just saying, hey, I do need a break. I'm not afraid to work hard. I'm willing to take another difficult patient. It just needs to be something different. And so I think that's big, or that's helped me a lot in my career.